centuries of medical history. At Provident, patients were offered various services, and one was treatment for medical emergencies. 2 years after opening, a young man was admitted after suffering severe injuries.
At the time, a young man had been stabbed with a knife and presented to Dr. Williams' hospital, and since his clinical condition had continued to deteriorate, Dr. Williams had to decide to operate on this patient contrary to the teaching and to the norm in the medical community at that time that cardiac wounds were not to be tampered with. He proceeded in opening the patient's chest, opening the pericardial sac lining of the heart, and discovered that the patient had a stab wound. This is a model of the head, and I will point to the region of the stab wound according to the description in his operative records. It showed about a half a centimeter or half an inch stab wound, about 2 centimeters from the right coronary artery, right around this region, which he repaired and closed the pericardium successfully, with the patient subsequently surviving and outliving Dr. Williams. So this was a major breakthrough, pioneering effort in the field of cardiac surgery, and for the first time confirmed that the human heart can indeed be operated on without any adverse consequences.
At stake was not only the patient's life, but the hospital's future. Dr. Williams was aware that if his patient died as a direct result of his surgical procedure, the public would probably turn against him and his hospital and force him to close.
When you go into an unknown area, you have unforeseen difficulties. To approach the heart in those days, if you go through the pleural space, the space that has the lungs would collapse as soon as they're exposed to atmospheric pressure. And in those days, the endotracheal tube that we use nowadays to keep the lungs inflated when the chest is open wasn't invented until 1914 by a Canadian surgeon, and the information on that wasn't widely disseminated really until the 1940s and 50s in even parts of Europe. So he had to deal with that problem. He was a well-schooled student of anatomy, and he approached it through what is called the bare